I was going to a free clinic right here in East LA, and I wasn't doing too good. I was on insulin. I was really down on being sick and everything. There's so many people going to free clinics. To me, the doctor didn't care. Here's your medication, go home. And I would ask questions, and they didn't have time. But I had no place else to go.
The East Los Angeles community has a long history of having been a medically underserved community. You have a number of residents here who are suffering from illnesses that could have been avoided, in fact eliminated, had they been the subject of proper medical care.
When I came here, everything was so different for me. I could feel myself better, really good. I got off my insulin within 6 months. I don't know if you can understand me how they made me feel like Helen's gonna make it. I loved it, and sometimes I ask God, thank you. Thank you for showing me the way over there.
The concept of the Center for Hispanic Health came about because we saw that we have a unique opportunity to tell a story. White Memorial, by virtue of its mission, it attracts a very high caliber of physicians, and we serve a population that has historically been understudied in research across the country, but also internationally.
The focus of White Memorial is to take care of the present needs of this medical community. But the center represents the future. That's the difference. It's about the future.
I think everybody looks for a better future, better medicines, for everything, not just diabetes, for everything. Because I'm doing good, and I know I'm going to do better. But the future is for my babies now.
The opportunity to treat patients in a more effective manner, that's not limited to this community. That's going to affect everyone.
We're looking at improving the health status of the entire country. We have an epidemic in obesity. We have an epidemic which then leads to diabetes and other chronic conditions like heart disease. And we've done very little to try to understand what are the root causes of those conditions. The Center for Hispanic Health can help us learn how to reach every sector of the population. So it's an investment in the future.
It's like that small ripple in the water that just continues to expand. The reach of what this center purports to do is limitless.
So I know whatever comes in the future, it's gonna come, and it's gonna come better. You should have seen me before. I was sick. I always had either a tummy ache, a headache, dizzy. So can you imagine if they, with research, and they find something, imagine all the people it's gonna help.
It takes commitment. Number two, it takes human resource. Individuals who are willing to do the heavy lifting to make it happen. There's a third part, which is dollars. So I would say to a donor, you cannot make a better investment to invest in White Memorial.
We're providing everyone with the ability to be a part of this legacy, so that when they look back and they happen to drive by this institution and they see the Center for Hispanic Health, privately, they can comment and say, much like I will, I was a part of that.
Take care of all these doctors, all these scientists, or whatever it is that's bringing into better medicine. My whole thank you to all these people right here is because I'm gonna spend more time with my great-grandchildren, because I know I'm gonna still be here.
It takes a caring institution like White Memorial and the people that are a part of it to say, it's got to be us. It's got to be now. And if not, who? And that's what they've done.